The Astodia diaphanoscope from Stila Electronic is a device used to search for blood vessels in the human body and provides a proven diagnostic tool in pediatric care. To achieve optimum results, Astodia utilizes the latest generation technology of high-power LEDs that allow dimming. These days, modern medicine uses transillumination or diaphanoscopy primarily to quickly diagnose pneumothorax, pneumoperitoneum, and hydrocele in the neonatal period. Increasingly, this method is also being utilized to visualize veins and arterial vessels in limbs during safe puncture proceedings. Astodia is a diaphanoscope that is no longer hampered by the previous disadvantages of diaphanoscopy, such as insufficient light power and/or thermal skin stressors. The possibility to control the size and guidance of the light on the handpiece are key factors in its practical application. The Astodia handpiece meets all of these criteria optimally. Thanks to its compact shape, which is rounded off on all sides, it can be used on all parts of the body, even while the baby is in the incubator. Moreover, the Astodia handpiece is designed in such a manner that it can be easily cleaned and disinfected. The Astodia diaphanoscope facilitates the search for vessels in safe puncture processes. It also helps professionals identify structures filled with air or fluid deep under the skin surface. The Astodia is especially suitable for patients in the field of pediatrics and preferably for premature babies and neonates. This is an excellent device for the determination of veins and arterial vessels in the extremities for puncture procedures. The Astodia arrives in a practical hard plastic case, which can also be used to store the device securely. The Astodia consists of a control unit powered by a rechargeable battery and a handpiece. The light-emitting diodes are integrated into the hand unit. One outstanding feature of the Astodia is the fact that the light colors can be adjusted. The special yellow-colored light has been optimized for vessel searches on small extremities. The arterial vessels and veins can be easily distinguished from the otherwise yellow ambient areas because they are dark. This greatly facilitates the puncture of tiny vessels. The red light ensures a continuous, extensive, and deep transillumination, which is required for vessel searches on bigger extremities, as well as for visualizing pneumothorax, pneumoperitoneum, and hydrocele, and is particularly suitable for vessel searches in extremities with greater diameters. The red light emitting diode is activated by pressing the plus button. The settings of the illumination strength can be increased in stages. If the yellow diode on the opposite end is the one to be used, the user quickly presses the yellow-red button to make the switch. Pressing the minus button results in the reduction of the illumination strength, while holding down the red-yellow button turns the unit off. Excessive heat that could injure the tissue can be completely ruled out thanks to a safety switch. Even if the device is used on the smallest of infants, it limits the intensity and time of use. Once the battery is close to losing its charge, the diode in use starts to blink to alert the user. However, at this time the device will still have sufficient capacity to complete the impending procedure. To recharge the device, the user simply pulls out the light-emitting diode cord and replaces it with the plug of the charger unit. The charger unit will recharge the battery in about 2 hours. Once the device has been used on a patient, it should be cleaned and disinfected. The cord and the control unit can be disinfected with conventional alcohol-based surface disinfectants and a cleansing cloth. In the event of an emergency, the Astodia is instantly ready for use. The larger the infant, the lighter the user will have to set up the diode, and the more the ambient brightness will have to be reduced. A pneumothorax is indicated if the air is in the pleural space. It is possible to distinguish between ventral pneumothorax conditions or definitive simple or tension pneumothorax. If hydrocele are indicated, the water in the scrotum is illuminated. The red LED is particularly suitable for the diagnosis of this condition. When searching for vessels for puncture procedures, the vessels can be identified easily because they are much darker than their surroundings. Using the yellow diode on the extremities of smaller children delivers even better vessel contrasts. Consequently, Astodia from Stille Electronic is especially safe to use on complex vessel conditions in very premature infants who are very small.